Match these activities to the stage of medical education in the UK given in an A opposite. 1. Dissecting cadavers, undergraduate. Number 2. Keeping a log of surgical procedures observed and performed, postgraduate. Number 3. Working for 4 months in accident and emergency to experience this specialty, foundation program. Number 4. Taking a 4-week attachment in obstetrics and gynecology, undergraduate. Number 5, taking an online course on recent developments in cardiovascular disease, continuing professional development. Complete the sentence. Look at B and C opposite to help you. Number 1, just before their final year, students have the chance to take an elective in a hospital of their choice anywhere in the world. Number 2, problem-based learning contrasts with an approach where each subject is taught separately. Number 3, these days lectures are often interactive, with regular opportunities for the students to ask questions. Number 4, in vocational studies and clinical skills, students learn how to treat and manage patients. Number 5, a student select module can be a topic from outside medicine, such as a foreign language. Number 6, dissection of cadaver is an important part of the anatomy component. Number 7, the medical school at the University Edinburgh is one of the oldest in the UK. 8, she is consultant at the Royal, one of the leading pediatric heart specialists in the country. 9, the Royal College of Surgeons in Edinburgh dates from 1505. 10, we have a seminar each week where we discuss topics in a small group with our lecturer. Match each of these activities to one of the components of the undergraduate course described in B and C opposite. Number 1, Julie spends 6 weeks working in a small hospital in the Himalayas. Overseas elective. Number 2, a group of students discuss together the possible reason for abdominal pain after meals in an obese 44-year-old male. Problem-based learning. 3, a small group of students trace the pulmonary artery in a cadaver. Dissection. Number 4, Otto spends a month working in the pediatric ward of the local hospital. Clinical attachment. Number 5, Anne learns how to take blood from an elderly patient. Clinical skills. Number 6, Juma chooses to study travel medicine in his 4th year. Student select model. Complete the phrases with verbs from the box. 2 phrases can be completed in 2 different ways. Look at A and B opposite to help you. Number 1, demonstrate a competence or how to do something. Number 2, supervise a trainee by ensuring she successfully completes her training. Number 3, deliver a course or a training program as a teacher. Number 4, take a course or a training program as a student. Number 5, access progress or competence. Match the 2 parts of the sentence. Look at A, B, and C opposite to help you. Number 1, an FY1 is a doctor, letter D. in the first year of the foundation program. Number 2, a demonstrator is an anatomy teacher, letter H, who teach this session. Number 3, a clinical trainer is a consultant, letter F, who provides training during periods of direct clinical care. Number 5, a medical school is, letter G, part of a university responsible for medical education. Number 6, a placement is, letter C, a period spent as a trainee in a hospital or in general practice. Number 7, a college is, letter A, a body of specialists responsible for delivering and assigning training in their specialty. Number 8, a fellow is a specialist, letter E, who has reached the highest level in their specialty. What kind of registration might this doctor obtain? Look at A opposite to help you. Number 1, a newly qualified Spanish doctor, provisional registration. Number 2, a newly qualified Nigerian doctor, limited registration. Number 3, a doctor who has successfully completed the first foundation year, FY1, full registration. Number 4, a senior health officer who has successfully completed the foundation program and gained a certificate of completion of training after a several specialist register post. Specialist registration. Write the abbreviation in words. Look at A, B, and C opposite to help you. Number 1, any doctor who wants to work in the UK must register with the GMC, General Medical Council. Number 2, some overseas doctors must pass the PLAB test before they can register. Professional and Linguistic Assessments Board. Number 3, Part 2 of the test consists of an OSCE, Objective Structure Clinical Examination. Number 4, in any emergency, remember the ABC protocol, airways, breathing, circulation. Number 5, before you can obtain specialist registration, you must have a CCT, Certificate of Completion of Training. Complete the test. Look at A, B, and C opposite to help you. My name is Musa. I came from Yemen. I came to the UK about 2 years ago after graduating. Because Yemen is outside of EEA, I could only obtain limited registration with the GMC at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If I have to give some advice to other candidates, it will be that at conciliation stations, you shouldn't simply memorize a set of phrases. It is better to really think about what you're saying to the actor and get the intonation right. After completing my year clinical training, I was able to obtain full registration, but I found it difficult to get a senior health officer post in my chosen specialty. Pediatrics, as hospital now, have to demonstrate there isn't suitable candidate from the EEA. Once I've completed my second foundation year, I should obtain a CCT, which will allow me to proceed to specialty registration with the GMC, an important step on the road to becoming a pediatric consultant.